Yeah, looks like we've got a great number of people joining us tonight, so that's terrific to see lots of people out. When the committee asked me to speak tonight virtually, they sort of said, "What do you want me to talk about?" And they gave me a couple of ideas, and lamb survivability was one of them, and I thought that was a really good topic for this time of year. So some of the things we're going to talk about tonight are maybe a little bit more specific to winter time, but most of the stuff we're going to talk about crosses through the whole year. It doesn't matter when you're laying. So, go to the next slide. So that's me, Dr. Rex Crawford, Dufferin Veterinary Services. Amaranth, Ontario is between Orangeville and Shelburne in Dufferin County, and I'm the past president of the Small Ruminant Veterinarians of Ontario for the second time in my career. Yeah, I've been president twice of that great organization. So it's a great organization for veterinarians to stay current on knowledge of small ruminant health and production information. So if your vet at home isn't a member of Servo, it's a great thing to ask them if they are or aren't, and encourage them to join it if they aren't. So what we're going to do tonight, we're going to talk a little bit first about reasons that lambs die. Then we're going to talk about some management challenges listed there: dystocia, hypothermia, not enough milk, some environmental factors. Then we're going to try to do some disease challenges, and I've got a couple slides at the end just in case I talk fast enough that we don't run out of time, but usually I go on too long. So that's that. Got a picture up here on the outline of two of my sheep mentors. The guy on the left is my grandfather, Dr. Crawford, and the guy on the right is Duncan Gates, both good old shepherds from Glencoe, Ontario, and that's a Suffolk ram that my grandpa exported to Mexico. So reasons lambs die. So one of the things that we can do, and we're going to walk through a little bit tonight, is what I've called the shepherd's postmortem of young lambs. And I'm going to thank Dr. Chris Bushbeck from Markdale Vet Services for the photos that I'm going to present here and a bit of the concept of this as well. We've done this at some district meetings where we've gathered people and done some postmortems on some dead lambs to try to help figure out what's going on, why they might have been either born dead, stillbirths, or lambs that haven't survived. Usually this is really, really designed for the first day or so of life. So what do we want to know when we're going to do this quick post-mortem? We want to know, did this lamb die before, during, or after birth? We want to ask the question, could I have prevented this death? And next question is, am I having too many of this issue, and are there bigger things that I need to change? So can we put this information that we've got into the big picture and see if there's things that we maybe can't fix for this lambing group, but that we can fix for our production system to try to decrease the number of these lambs dead in the first 24 hours or so of life to keep us happy there. So what are some of the things that we want to do? We want to record who the mother is, who the dam is. We want to record the sex of the lamb. We want to record a birth weight. And I think it's a great idea to record the litter size as well. When we are going to do these postmortems, we're going to wear gloves because there is potential for diseases that can pass from those dead lambs to ourselves. So we want to try to mitigate that the best we can. I think it's really good idea to have a discussion with your vet if you should be opening up or how much handling you should do of lambs that you believe have aborted or might have aborted. And different people are going to have different risk levels to whether they should be touching and handling those aborted lamb fetuses. So people that are immunocompromised, people who are or might be soon pregnant, probably should stay away from those aborted lambs for sure. And we may ask the question of whether there's value in opening those lambs up or not. If we're going to decide why an abortion happened, that's going to be a workup that needs to happen mostly at the lab, the animal health lab at the university as well. So I'm not saying don't do it, but have a discussion with your vet about whether that's a thing that is going to help you figure things out or not. So some of the things we're going to do before we open the lamb up is we're going to inspect the outside of the lamb. So we're going to look for meconium staining. That's the yellow ick there, which is the lamb passing that first feces that's in the colon at birth or before birth while they're still inside the ewe. And so they're going to turn that yellowy brown color if that happens. So that's a lamb that's stressed during the birthing process. We're going to look at the placenta and decide whether it looks normal, whether it looks extra thick and purple and gross, if it's there or it's not there. And then we're going to ask ourselves the question of, did the lamb walk? So the lambs are born with those sort of soft, slippery things on the outside of their hoof, on the bottom of the hoof, that protect the yow's uterus from being punctured by that hoof. And they're going to wear that off very quickly. So left-hand picture is a lamb that never walked. Right-hand picture is a lamb that obviously walked probably a fair bit because we've got that wore off. We've got some manure stuck on there. So if that's a lamb that we think is 12 hours old and dead, we're going to say for sure that it got up and wandered around. And then we're going to ask some more questions about that lamb later. So then we're going to ask the question. So then we're going to open the lamb up. So we're going to, when we do that, we're going to mostly open that lamb up right on the midline of the abdomen. So right square on the bottom of the lamb, really, we're going to take the skin and skin it backwards, and then we're going to cut the rib cage pretty close to the midline and reflect it backwards. There's a little bit of tissue back here that covers the intestines and guts. And so we're going to open that up and just kind of leave everything where it is otherwise for right now. And so then we're going to ask the question, are the lungs inflated or not? So if the lung on the right-hand side is a pink, spongy, happy lung that was filled with air and did its job, on the left-hand side we've got a dark, small, and that will be hard, firm to the touch, not spongy. And so that's a lung that hasn't ever taken air in. We sometimes float a piece of lung to help us decide whether or not it has taken on air. That's not a foolproof yes or no answer. So lung that has air in it should float for sure. Lung that doesn't should sink, but it's not a perfect test. So most of the time we can just tell by looking at it pretty well whether we've got inflation or we don't have inflation. We're going to also ask the question, are there signs of trauma? So if we have a whole big pool of blood in that chest cavity or in the abdominal cavity, then we're going to say, there's maybe been bleeding happening here. What's going on? And there's a couple of different reasons for that. There's trauma during the birthing process that could do it. More likely, there's trauma after birth. And so that might be a case where either mom or maybe another yow has decided that the lamb is evil and needs to leave this world. So it will actually be beaten up. We've all seen yows that decide that lambs are bad and go attacking them rather than trying to love them. So, and sometimes we've got yows that get really aggressive and trying to get started as well. So a lamb that's recumbent and not getting up fast enough, a good mom will sometimes do some crazy things to try to get that lamb up and going, which can end up as trauma to that lamb. We also want to inspect the ribs a bit to see if we can see signs of fractures. So most of those fractures will be kind of midway through the rib, and you'll just see a crack in it and think, oh, why is that there? That shouldn't really be. So we might want to check both sides of the rib for that. That could be associated with birth, and again, could be trauma afterwards as well. So we got to try to tease that apart sometimes. If the trauma has happened during the birthing process, enough to break ribs, probably that's been a lambing that we had to help with, and not one that was born on its own to cause that trauma, but those things can happen for sure. So then next we're going to ask the question, and we're kind of leading down a path here, right? So that if we decide that we don't think a lamb lived, then some of these things aren't going to happen, right? So if a lamb was born dead, then its lungs aren't going to inflate. If a lamb was born alive, then its lungs are going to inflate, and then we ask the next questions. So we want to look at, so this is looking at the kidney, and so on the left-hand picture here, in between the forceps, we've got the kidney surrounded with some stuff, and that stuff is fat. And over here, we've got kidney that is just easy to see, simple to find. And so that's a kidney that all of the fat is gone. So that brown fat is something that we talk about that's incredibly important in lambs and really, really, really important in lambs that are born in cold conditions in the wintertime. And so that brown fat is essentially the battery backup of the lambs. So they run off that brown fat until they can consume colostrum and start to absorb nutrients out of it as it goes through the intestinal tract. So if we would take too long to get that colostrum in there and get it through the intestinal tract, we will run out of battery. Just like think of the battery on your phone. If you do too much, we can run right out of battery. And you can think of cold weather to your phone battery being the same as cold weather to that brown fat. It's going to get used up a lot faster. You're going to run out of battery quicker in cold weather than you are in summertime lambing when it might be 20 degrees out when that lamb hits the ground. So we've got a lot bigger window of time when it's warm out than we do when it's cold. And so getting that colostrum into those lambs is really important. So that if we can find some whether we can find some brown fat or we can't, the next question is going to be, is there milk in the stomach? So we're not going to be able to visually tell whether there's colostrum or milk in the stomach, but collectively, is there white gooey stuff that is most likely colostrum at the time we're going to look at this? And has that milk made it to the intestines? So can we see something more than meconium back in the intestines, or is it just did it maybe just make it to the poor stomachs, to the rumen, the basement, and not make it any further before that? So switching gears a little, so those are most of the questions that we're going to answer out of that postmortem. And that's something that, some people may take away from this tonight and go, boy, I'm really excited to do that and take some pictures and talk to my vet about what I'm finding. That's awesome. If you are, if that's something you're like, no way, I'm squeamish, I'm going to faint if I do that, that's okay. We can still answer lots of questions without doing those postmortems, or we might find a friend that is keen to do them, or in some cases, we might even invite our vet in to do some if we happen to have more than one or two in a short period of time, and we want to learn from them. It's the kind of thing that economically probably is a struggle to make it worthwhile to have the vet out to do one dead lamb postmortem. But if you had a few, or in some cases, the vet might be okay with you bringing the fetus or the lamb to their office to do a quick postmortem on them to help us figure out what's going on if we think we're having too many of these. So that's great. So dystocia is one of the things we've kind of talked about this a couple of times. So dystocia is a fancy word for lambing trouble. Cannot be born by itself. And so we have multiple reasons for these. And some of them go together and some of them are separate from one another. So dystocia is often a problem if we've got big, large single lambs. So, 25 or 30 pounds is probably the biggest lamb I've seen born as a single, and at least one of those was born to a not very big mom, born to like 120 pound, maybe first time lammer with about a 30-pound lamb in there. So obviously that math didn't work very well for mom. Just way too big to get out. So managing those singles can be a challenge, and especially if we have really prolific breeds of sheep where we're nutritionally managing them for 3s and 4s born in a litter, and then we get a small percentage that have singles, or we maybe mix a couple of breeds together and we feed some that are very likely to have singles or twins the same as we feed some that are very likely to have 3 and 4. We can definitely increase the size of those single lambs. As we get into those multiple lambs, as we get 3, 4, 5 lambs in there, the tangling increases exponentially. So dealing with figuring out what legs belong to who, and getting those out one at a time can be a challenge, and can be a reason for stillbirths for sure if we're not managing those yos quite aggressively enough. So, and that's always a challenge to figure out how much time we spend in the barn, how quickly we intervene on those sheep to help. And too early can create problems, and too late can create problems. So it's, a little bit Goldilocks of trying to find what's just right for your farm there, and managing all of the other things, sleep, work, looking after other animals on the farm and getting that done. And sometimes we have to decide that we're going to spend a little less time with our lambing yos, but it means that we're going to do more stillbirths. So that's a balance everybody's got to find. If our yos are too fat, that can create issues, because as we fatten yos, the birth canal starts to get smaller. And so we can create just too small a space in the pelvic canal to get those lambs out if we've got those yos at a level of nearing obesity. So they've got to be pretty fat to create issues, but it can be an issue sometimes. And for sure, if we have hypocalcemia, low calcium, or what we call milk fever in dairy cows, or pregnancy toxemia, which is a imbalance in energy leading to illness in the yos pre-lambing. Those yos often do not lamb very well on their own. They don't get right down to lambing. If we have low calcium, they lack the muscle strength to push those lambs out. If we have pregnancy toxemia, we very likely have a weak yo and a weak lamb, or several weak lambs, in creating issues. So kind of alluded to that question of, how do I know when to help? And the question of, does she need help or doesn't she? So the general rule of thumb is that we want to wait about an hour from the time that we are sure that she is truly lambing. So my go-to for that is that we can see placenta of some kind. So we can either see a water bag out, or we can see a little tag of placenta that the water bag is likely come out ruptured. And then the question always is, well, did that happen 2 minutes ago, or did that happen an hour ago already? So that is part of the learning process of lambing, to figure out where we think we are in that. But we'd like to wait. We'd like to give her about an hour from the time that we see that placenta or that water bag percent, so that she can do the normal processes of getting ready to lamb. In first timers, we might even wait an hour and a half before we intervene, because they're sometimes a little bit slower to figure that out and do that. My preference is not to move a yo when she is presented at that stage of lambing, if we can help it. I would rather leave her alone where she is and try to keep her life as quiet as we can right then. More often than not, if we find a yo like that and we put her in a lambing jug, then we have disrupted her world. And some of those yos, depending on their outlook on life, their excitability, may spend the next hour trying to get out of that pen and away from aloneness, and want to get back to the spot that they had picked to lamb. And so we can actually create more dystocias and more yos that we have to help if we do that. So my preference is to leave them alone until we decide that we need to help, and then get them somewhere we can help them. There are definitely places that manage lambing yos, especially if they have tight lambing groups, in the way that they create their pregnancies, where they put a whole bunch of yos in lambing jugs ahead of lambing, and that can work okay, because we've got enough time to adjust to the fact that we're in that pen before the hormonal process of beginning to lamb happens. And that can work okay as well. So if that's what you do, don't stop doing that, because I said maybe don't move them at the point they've started lambing. When we're helping, we want to be clean when we do it. We want to remember that we are shoving things inside the yo that don't belong there, mostly our hands. So being clean about it is really important to decrease the chances that the yo gets an infection afterwards. It's a great idea to wear gloves when we're doing this, to increase that cleanliness and decrease the risk of infection to ourselves. I will admit that I helped too many babies into the world before I became a veterinarian to enjoy wearing gloves when I do these things. So I generally don't, but I generally encourage other people to do it. I think it's a really good idea, especially if things are tight, to be prepared to add lubrication. So whenever I go in to do a lambing for a client, I always make sure that in my bucket of warm water, I've got soap to clean up with, and I carry a bottle of the same lube that I use for doing rectal exams in cows, ready to help me get in sometimes by lubricating my hand, and sometimes help get the lamb out by adding lube to the outside of it to make it slipperier to slide out. I occasionally, if I get into really tight situations, actually use the same tight tube that we use for tubing colostrum that I think we're going to talk about a little bit in a few slides. I will sometimes use it and a big syringe to actually squirt lube in around lambs in spots where I have trouble getting my hand in to put lube on with my hand. And I find that can really help in some of those, especially really big, usually dead lambs that we haven't caught in time. And so they've started the process of rotting inside mom. Those they get a lot bigger and dry out pretty quickly in there. So adding more lube to those can make a big difference. And then positioning is really important when we're in there trying to figure things out. So we either need a head and 2 front feet, or 2 back feet and hopefully a tail to get out. And those 2 legs and a head, or 2 legs and a tail, all need to belong to the same lamb. So we need to be practiced in working that out so that we can get those lambs out right, and that we don't spend 10 minutes looking for a head that's supposed to be near a back leg. So one of the things that can help, and I probably should have put a picture in of this, is helping to figure out whether we've got front leg or back leg. I think is really important. And so the best way to do that is to figure out the fetlock or ankle joint of the lamb, which way it bends, and then which way the next joint bends. So if it bends in an S shape, so fetlock always wants to bend this way. If the next joint bends to make an S shape, then that is the hock. And if it bends in the same direction as the fetlock joint, then we've got a front leg to make sort of a C shape. So if that next joint bends, think of a lamb's front knee, how it bends, when they tuck their legs under them, versus a back leg where the hock bends the opposite way. So that's the thing that's I think the important thing to help you figure out whether you've got a front leg or not. Because if you get them twisted up, sometimes everything can feel. If you've got an upside down backwards one, the foot will be coming the same direction as normally presented front leg. So you got to be careful of just using that as your guide. And once you've started helping a yo have her lambs, my opinion is you keep pulling lambs until you're done. We don't leave her to finish up, because by the time we decide that we want to intervene and help her, she's a bit tired and those lambs are ready to come out. So just keep pulling lambs and we'll get away there. So, and essentially after you pull a lamb, go looking for another one, no matter how many there are. So if you find 1, look for 2. If you find 2, look for 3. If you find 3, look for 4. If you get to 9, you're probably done, even with a Romanov. So, but keep checking, right? Make sure that you've got them all out the best you can. You got to reach in there a fair ways sometimes to look for things. I sometimes, in older yos with weaker abdomens, I even use my opposite arm to kind of push up on the abdomen to help me make sure that I've gotten deep enough in that yo. So, yeah, that's lambing. And so, yeah, so then lamb vigor is sort of the next topic to talk about. And so there's a bunch of things that go into how vigorous our lambs are when they're born. So lamb numbers, or litter size, or prolificacy definitely plays a role in that. lamb numbers are determined between a combination of genetics and nutrition before and at breeding. And in some flocks, flushing may be counterproductive. So we've traditionally recommended flushing around breeding time, so increasing the energy for sure, and maybe the protein as well in a couple of weeks before we begin our breeding program, and then during the time that the rams are in. If our ewes are in really good body condition at that time, the impact of flushing is really close to zero. If we have very prolific genetics and we've got ewes in decent condition and we flush them, we may create more lambs than we want to. So we may create a whole bunch of triplets and quads, which may not be our goal and may lead to a decrease in lamb vigor because we just made too many of them and they get too small. As we do that, we can get challenges with then backing off nutrition too sharply after that breeding period is done. And that's a really important time for the placental development in the first 2 months or so of gestation is when that placenta develops. And if we don't feed those ewes enough, then we don't develop a really good placenta. And especially if we've got 3 or 4 or more lambs in there, we can get into challenges with placenta having enough space, enough ability to do its job to feed all of those lambs. And that's often when we get into what one of my clients and I together call big little syndrome, where we get maybe 2 triplet lambs that are really normal size, really vigorous, really normal. We get one little teeny tiny runt. And when we get that, that is almost for sure a case of that runting lamb not getting its fair share of the placental feeding during gestation. And those lambs will then be smaller and not very vigorous. So if that is a challenge, then we need to work backwards on what our nutrition program looks like, usually just after we've pulled the ram from a herd. So 30 to 50 or 60 days of gestation on most of the ewes is when we can get into issues there. If our protein is low in the diet of the ewes in the last month or so of gestation, we can get lambs that are born weak and dumb and not very vigorous because we just haven't given the ewe enough protein to keep feeding those lambs well, and they just lack vigor. So with hay quality, like we have seen from this past summer, which was in most of Ontario worse than the summer before that we thought couldn't possibly get any tougher to make hay. Our protein in a lot of our first cut hay is not where we need it to be to properly support the growth of pregnant ewes. So we got to watch that for sure. And we just got to watch the balance of that all together. If we add corn silage to the diet of those close-up ewes, corn silage is a wonderful energy source feed, a nice, safe forage, easy to make and usually relatively easy to put up, but it lacks protein. Most corn silage is in the 8% or so protein, and the total diet of those close-up ewes needs to be in the like 12 to 14% or something like that number. I'm not a nutritionist, I know that. So we got to watch that, and we got to make sure we're adding protein or feeding really high quality forages, hay forages along with that corn silage when we add corn silage in. There is a little bit of lamb vigor that might be genetic, but it's not enormous. And I don't have on there, like I probably should, that when we talked about those big singles and the dystocias, we can have issues where we have lambs that lack vigor because even if we didn't help them into the world, we maybe should have. So those lambs are born on their own unassisted, but had a pretty tough go. So those big single, often ram lambs might have a little bit of swelling to their head, might have a little bit of swelling to their tongue, and those lambs will be just stupid. And they take a bunch of work to get going and become a real pain in the butt. Trying to it's another reason to try to decrease some of those big giant singles because they can have issues with vigor as well. I have seen cases where we had real problems with lamb vigor in groups where we had abortion problems in that group of lambs, most particularly with Campylobacter. And where the placenta of the yolks that live lambs was probably affected, but not bad enough to cause an abortion. And those lambs are just born weakened, and particularly in cold weather, they can be a real nightmare to keep alive and can be really frustrating and disheartening for the producers because in many cases we've just lost 10 or 15% of our production to the abortion outbreak, which probably felt like it was over a week or so ago. And now we're into lambing and we've got just a bunch of dumb dud lambs that just don't want to take off, or often born a little on the skinny side, so they're more susceptible to cold, and all of those things. So just be aware of that. But sometimes if we've got some abortion bugs in play and we're having trouble with lamb vigor, just remember that might be part of the continuum of those abortions. Hypothermia, cold, low temperatures. So the best way to prevent hypothermia is to have lambs doing that. Up, nursing mom quickly. I like to say that lambs and kids both that are vigorous and happy feel like they hit the ground, bounce up, and start looking for a teat. So that we love when we get lambs that are not very many minutes old, that are already working on getting to their feet and starting to look for a teat to get that colostrum. That's awesome. In lots of cases, if we have vigorous triplets born, the first one might be up looking for a suck by the time the third one's born in a normal cascade of events. And that's great. And colostrum is incredibly important to lambs. So it's incredibly important to stop that hypothermia cascade that we're going to talk about a little more in the next couple of slides. It's also incredibly important to setting up the immune system of those lambs. So lambs get an incredible amount of their immune system through that colostrum. So we'd really like those lambs to be nursing, I'm going to say within 4 hours, almost for sure. 8 is a really big stretch, and in cold weather, 8 is way, way, way too long. And remember that normal is like super fast, right? Normal is under an hour, nearly for sure. So best case scenario is nursing, and nursing, if they're going to nurse well, is probably the very best way for lambs to consume colostrum because it does all of the things. Bottle is second best and used rarely because it takes a lot of patience and time, and it's okay if we only have one lamb to worry about, but if we have 22 lambs born tonight and we need to worry about them all, a bottle is just going to take a bunch of time to get done there. So often if we need to help with colostrum, we're going to tube those lambs. And so we're going to tube them or we're going to bottle feed them. We talk about using 20 mils per pound in that first feeding. And we need much more than that total over the next 24 hours. So we need something like about 100 mils per pound over the first 24 hours of life to get those lambs off to a really good start. I don't have a great picture in here, which I probably should have of tubing those lambs, but if you're gonna be in the lambing business, getting comfortable with tubing a lamb, I think, is a very important thing. It's relatively simple to do. We need to slide that tube down, and essentially the worry and the risk is that we need to get that tube into the esophagus, into the tube that goes into the stomach, and not into the windpipe that goes to the lungs, because colostrum in lungs equals a dead lamb. So we want to slide that tube in, and we want to feel it going on the left side of the lamb. So I'm left-handed, that's my left side, and we can feel that tube go down the neck on that side. And if we feel that happen, then we're in the right spot, and we can run that colostrum in there. I like to run that colostrum in by gravity, so I take the plunger out of the syringe and use it as a funnel as opposed to shooting it in with the syringe, because nothing else, it gives us a little more time to make sure that stuff's going in the right direction and we go in too fast with it with a syringe. Some of that milk can come up around the tube and back into the back of the throat and then down into the lungs. So gravity feeding it is a nicer way to go for that. So hypothermia, why we care. Cold and starved lambs die. Pretty simple. Here's a poor little lammy that looks like he's a little lambsicle that is going to get in trouble really quickly here. So prevention is the best cure for hypothermia for sure. So if we can get that colostrum into those lambs early, before they even think about starting to run out of that brown fat, then they're off to the races. If we can keep the temperature in the pen they're in warm enough that they don't get a chill, that can help. If we've got mothers that love them and dry them off quickly, that can help a bunch as well. And we can do things to mitigate some of those things, right? We can figure out ways to make our lambing area a little bit warmer. We can sometimes add heat lamps to some lambing jugs to make sure that those lambs stay warm. We can put little lamb coats on some of the lambs. And we might not do it for every lamb, but we might do it in triplet lambs that weigh less than 6 pounds, because we know they're at the very highest risk because they don't have any body cover to help them with. We can do things like that to help prevent it. So we're going to talk through the what to do if you have a hypothermic lamb here. And so there's some categories that we're going to use to decide a little bit what to do. So the internal temperature of the lamb, the rectal temperature, below 39 degrees is where we start to worry about hypothermia. Below 37 is where you're cold. And so that doesn't seem super duper cold, but it's pretty cold for that lamb. Age is important. So if we think or know that you're less than 5 hours old, then we put you in a category that says you may not need the whole treatment. And certainly if we've got a suckle reflex, that is a better than no as an answer. Heat can kill. So if we warm lambs up and they don't have an energy source other than the brown fat that they're probably already running out of, as we heat them up, they use more energy and they will keel over if we don't figure out a way to add energy. So that brown fat is there until it's not. And if we think that it's about run out, then we're going to add a dextrose injection, a sugar solution injection to these lambs for them to run on until we can get the colostrum into them and going. If we think that they've got enough brown fat left to keep them going for a little bit, we might tube feed them colostrum and then warm them up to get them going. So lambs that are between 37 and 39 degrees and less than 5 hours old need colostrum, so they need likely tubed with colostrum, and then they need to be monitored very closely so that we know that they come up to 39. And that might depend a little bit on what our conditions look like too. If it's minus 12 in our barn, we might do more for those lambs than if it's plus 5 or minus 1 or something. So we got to watch that a little bit. Lambs that are less than 37 degrees and less than 5 hours old, we believe will likely have some of that brown fat left. And so they need to be tubed with warm colostrum and then warmed up somehow. And so this is a little diagram of a box for a heater that that sort of does all of the things nicely. There's lots of different ways to do this. This one's designed, so it's designed with a screen or some sort of open bottom-ish tray that raises the lamb up off the ground. This one's got hair dryer holes on both ends of the box that we can put hair dryers in there to warm it up. We only want to warm that box up to about 40 degrees Celsius, which is pretty freaking hot if you're ever on the beach. But we don't want that box to be 60 degrees and cook them. We want to warm them up. We don't want to cook them. And that's really nice so that we can warm that lamb from all the way around it. So if we leave that lamb on the ground and add that heat to it, the top half is going to warm up a lot better than the bottom half. So we either got to make sure that we keep moving that lamb so that we have both halves warmed up, or this is a really nice way to do that. And yeah, then we got to make a good idea that we regulate that temperature. So we either get really fancy and do that with a thermostat, or we probably need a thermometer directly in that box so that we know what the temperature is in there, so we don't get it too hot, but we get it hot enough to do the job. So we want to do that. And then the next step in that cascade is lambs that are less than 37 degrees Celsius temperature, and we think more than 5 hours old. And that 5 hours old is a guideline. So again, if we're in really cold conditions, and we've got lambs that are 3.5 or 4 hours old, and they look really lambsicle-y, we might go to this dextrose injection before we start heating them up, because we want to be sure that we don't run them out of energy. We run them out of that fat. So if you're going to start doing this, and you've got lambs that you think look tough, although they don't meet this criteria exactly, the dextrose injection is fairly safe. It's not going to cause any major troubles if we do it in some lambs that don't specifically need it. So in those lambs, we want to do that dextrose injection. We want to tube them with colostrum. We might warm them up briefly before we give them that colostrum, but not certainly all the way up to 39 degrees. And then we've got to get them warm in that box or beside the fire or whatever it is that we're going to do. And so when we do that dextrose injection, we're going to use 10 mils per kilogram of 20% dextrose. So for a 5 kilogram lamb, 10-ish pounds, we're going to use 20 mils of dextrose and 30 mils of sterile water. So we're going to dilute that dextrose out because it comes from the vet or from the feed store as a 50% solution. So we want to dilute that down because that's too strong. That's too strong. Think of it like whiskey. It's really going to be really hard on the guts that we're putting it around if we put it in at that concentration. And then, so what we want to do, so the picture here tries to show it to you. We're going about an inch below the navel. Navel's easy to find on a newborn lamb. And just to the side a little bit, I like to use a 20 gauge 1-inch needle. We definitely don't need to use a needle that's any longer than that. We don't really want to make a hole a lot bigger than a 20 gauge hole. And we're going to aim downwards, usually kind of towards the opposite hind leg with the needle. And so in this case, the lamb's head is up. There are ways of doing this with the back legs up rather than the head up, but the method I like to use holds them either by those front legs or by just kind of in the armpit. There is what we're showing. And then we just kind of want to make sure that our needle doesn't hit anything major in there. So about all that's in that part of the abdomen of a lamb, especially that hasn't consumed any colostrum, is fairly empty intestines. So we're pretty safe to do that injection there and then get those lambs off to the races. So that's a quick and dirty story of hypothermia, but certainly this time of year, for some of you that haven't heard of this, what we call intraperitoneal or IP dextrose injection, if you've been struggling to get lambs warmed up, it seems like every lamb that you try to warm drops over dead on you. this dextrose injection might be a real game changer for you. Or if you've been warming lambs up and thinking we've got to get them warm before we put that colostrum in them, adding that colostrum first and then warming can make a big difference. It also helps warm those lambs up because we're putting warm stuff in from the middle. So we're heating those lambs from the inside out and the outside in, both when we put that colostrum in there. Not enough milk. So not enough milk doesn't usually kill lambs for about 10 days to 2 to 3 weeks old. Because often mom's got enough milk to keep a little wee lamb going but as that lamb gets bigger, its requirements get higher, and we can run into trouble. And those lambs that are in borderline starvation are more likely to get some of the other diseases, and run into trouble as well. So one of the solutions to not enough milk is to foster some lambs. So to decide that if we've got a triplet, on a yoe, and on the same day a yoe that we think milks well and is otherwise a good mother has a single, we try to make one of those 3 triplets into her twin. So starting early, the earlier in life we try that fostering, the better it's going to work. Strong but hungry lambs are going to be the best lambs to foster. So actually taking the most aggressive lamb and trying to foster it might actually go better than picking the one that we like the least of the 3. To do that, smell is key. So if we can get birthing fluids and placenta from the yoe that has just lamb that we're trying to foster a lamb onto, and we can rub that lamb into, those fluids, that's going to be a great way to trick mom into thinking that that baby is hers. Fostering may not work well for us. We may not have a yoe that's a good candidate as a foster mom. We may just have too many lambs that we want to supplement with milk, to make fostering work. And in that case, we're gonna raise them on milk replacer. So if we're going to have a milk replacer group, especially that we take away from moms completely, and raise in a separate pen someplace, colostrum is incredibly important. So making sure that those lambs get enough colostrum, and in some cases, supplementing some of these lambs with colostrum replacer is going to be a really good idea. And if we're having a bunch of trouble with lambs, with diseases early in life, but we get them going for that first week or so and then run into trouble, our colostrum quality and quantity is something to think about, whether these lambs are getting enough, colostrum out of moms. Typically in meat sheet, we think likely that their colostrum is fine and don't really think much of it, but we can do some things like measure the density of that colostrum, with a colostrometer, or a Brix refractometer, to try to decide how strong it is, how dilute or strong it is. We can't really measure quantity very well in sheep because we're not going to milk them out and then feed that, because that's just way more complicated than getting those lambs nursing on the teat. We can. And then, so if we're hand raising these lambs, the consistency of our milk replacer delivery is incredibly important. So weighing out that colostrum powder to know how much we're putting in, and giving that consistently, all the time it's really important. The best we can do to make the timing of that delivery as consistent as we can is good. And we want to feed about 20% of body weight, per day in multiple feedings. So if we can feed in 3 or 4 feedings, that's better than twice. Decreases the risk of causing problems from drinking too much all at once, and will allow those lambs to grow really well and essentially close to keep up with, or maybe even sometimes do as well as, lambs that are nursing in moms. So feeding strategies, we can do that milk replacer feeding through bottle feeding. We can do group feeding. And we can do acidified milk, treating with ad lib milk, so we can have milk present there all the time. If we do that, an important thing to remember here, and something that gets lost a little bit sometimes, is if we're going to do this, what we call acidified milk in an ad lib feeding feeder where we feed it cool. So that's usually in a bucket with nipple lines on it. But there's a bunch of different ways to do that. But we're going to have milk there all the time. We want to feed it cool, so like 20 degrees Celsius. We don't want to put it out there at 30 some degrees baby bottle temperature that we would normally feed a bottle at. And we're going to make acidified milk replacer by adding formic acid to that milk. Acidified milk replacers that are available on the market that say acidified milk replacer on the bag or on the tag of that have a little bit of acid added to it to aid digestion. So think of that as milk replacer that's got a little bit of the fancy yogurt with the dancing belly on the TV commercials in it. This addition of formic acid actually changes the pH of the milk replacer so it doesn't spoil. So those are two very different things. And if we think we want to do this system, we need to add that acid to it. We can't rely on the acidification that's happened at milk replacer factory. So try and remember that. Lots of you have one of a couple of systems of automatic feeding systems, which can work very well for raising bottle lambs. Cleanliness is next to godliness when it comes to those systems. And the other thing that's washing nipples, washing lines, and calibrating that machine to make sure that the amount of powder that's going into each mix is what it's supposed to be is incredibly important. So if we aren't good cleaners, we should find the cleanest person in our household to be in charge of that milk replacer machine, so that they keep it clean on a regular basis. People that do that very well on an ongoing basis often have two sets of everything so that they can have one cleaning and one on all the time. Yeah, that calibration is important so that we get the right amount of powder in there. And for sure needs to be done, should be done more often than that, but for sure needs to be done between different lots of milk replacement. So even if it doesn't really matter whether we buy a bag at a time or a skid at a time, when we switch to a new bag, if we're buying a bag from a feed store as we need it in small situations, or if we're buying a skid at a time, and we get a new skid in, for sure need to calibrate them because the density of that milk replacer will change a little bit from lot to lot. So we need to do that for sure. We can wean those lambs as early as 20 or 25 pounds. I like 25, but some people like 20. If we leave those lambs on milk replacer, especially in a system that allows them to drink all they want, they will drink more milk replacer at like 30 to 40 days as they will in the first 30 days for sure. So there's a balance there of happy, healthy lambs and getting them weaned and getting them off that milk replacer so they don't bankrupt us with milk replacer costs. We for sure want to have crate feed in those pens where the milk replacer fed lambs are. And we absolutely need to have water in those pens that is accessible to those lambs. Those lambs will do a ton better, and for sure they will start eating creep feed better and eat more of it if we've got water there for them to balance the dryness of that creep feed. So water. Creep feed, water. Hay is not very important to those lambs, and if you put hay in there, you're probably doing it to make yourself feel good. They will eat it, but it probably isn't changing their life very much. And there's lots of good data out of the cow world that shows that feeding grain to animals on milk or milk replacer increases the rumen development better and faster than adding hay in, even though that isn't really intuitive. You would think that adding hay in would help the rumen develop better, but it seems not to. Not enough milk. So consider the economics of producing too many orphan lambs. So if we have too many ewes that have bad udders, so have had mastitis at some point and are not producing on one half or maybe both halves of their udder, or just plain don't produce enough milk due to genetics or due to the way we feed them, for the number of lambs that we want them to feed. Those yos should find a different job, especially in our current environment of pretty nice high cull prices. We want to optimize the lamb numbers for your system. So that doesn't mean maximize. That means finding the right numbers of prolificacy for you. So not enough isn't always good, but too many can create sometimes more problems. So finding the right number for you, and that's different from every farm. So you can find people who routinely wean, in the high twos, 2.7, 2.8, 2.9 lambs per yo that lambs. And you can find a number of people that lamb over 3 and wean somewhere around 2.2. So those guys are probably creating more than what their system can handle, and maybe bringing that prolificacy down a little bit might actually help them make more money. Meaty and mastitis are both contributors for that milk production and udder quality side of things. So if you're struggling with mastitis, we need to understand that and figure out why that's happening to us. It most likely means we need to change some things that we do around weaning time to protect the yo from getting mastitis. So that might be when we wean, that might be the environment that we wean into, cleanliness and things that way. And it might sometimes mean that we need to talk about using some antibiotics on those yos. If we have yos that don't look like they have mastitis or look like they have problems making milk on both sides of their udders symmetrically without things that make us think about infection in the udder, but feels like we don't have much milk production, think about Meaty Visna as a disease. Talk to your vet about whether or not you may have that may be contributing to low milk production, particularly in animals as they get older. So yos that we thought were good milk producers in their first 2 or 3 lactations that then start to tail off. Think about Meaty Visna in those. Environmental things, and I'm just about out of time, but we'll roll through this the best we can. So our lambing area should be clean, dry, and draft free, and warm enough to prevent hypothermia. So warm enough that we can get those lambs started without getting them chilled and cold. After a few days of age of those lambs, the things kind of switch here. So air quality, stocking density, and cleanliness trump warmth. So we still want to be draft free. We still don't want the wind blowing over those lambs, but making sure the air quality is good, that our stocking density is okay. We've got enough straw in that pen or whatever we're using to bed to keep our ammonium levels down and keep those lambs someplace warm so that we can actually. So I really, as we drop the temperature in a space, I really like straw and fluffy straw so that those lambs can snuggle into it. To help stay warm can make a big difference. We want 16 to 20 square feet per yo with her lambs. The more lambs we have in there, the closer we need to be 20 square feet. We want 6 to 16 inches of bunk space in there so that those yos can get in and eat. And I'm going to argue that whether we think yos are self-fed or not, they're really meal-fed, because when we bring new feed, all of the sheep want to eat at once. So having lots of opportunity for those yos to get in there and eat can help a lot. And making sure we're feeding them enough stuff to keep them out of trouble. One of the biggest wrecks of lamb mortality that I ever dealt with, and we started down the path of a whole bunch of different diseases causing problems in lambs dying they were mostly 2 to 3 weeks old, came down to a producer that was ignoring his nutritionist advice and was feeding about 2/3 of what he was supposed to, because he was going to run out if he fed what the nutritionist told him to. Created a disaster of dying lambs because we didn't feed the yos enough to make enough milk to make them happy. Most of those lambs died overnight, piled up in relatively tight spaces because they were cold and they were starving. They had not enough energy to keep them going. Coccidiosis as a disease, pasty diarrhea, weight loss, poor gain in lambs, generally over 3 weeks old. Very occasionally just a little bit under that, down to about 16 days as a minimum. Coccidiosis is a major challenge in confined rearing sheep. Coccidiosis follows a fecal-oral cycle, so lambs get infected by eating poop that has coccidia in it. Most ewes carry some level of coccidiosis, and our goal should not be to try to make coccidia-free ewes. That isn't the solution to the problem. But coccidia definitely builds up in barns and pens, so that the longer that we have lambs in a pen, the more likely there is to be coccidia at an infectious level in there. Coccidia is often a one more stress disease. So these lambs are often dying of things like pneumonia, but the coccidiosis is what set up the opportunity for the pneumonia to jump in there and cause trouble. We can often get lambs that have pretty severe coccidiosis that we manage to treat and help those lambs survive. They grow very poorly for the rest of their life because we get some scarring in the intestines that screws them up forever. So decreasing the shedding in the ewes, I'm going to argue, isn't very important, but we might do some things like use a coccidiostat in our ewes in the last month before lambing and maybe during lactation. I've got a question mark on that, and to me, that's not a very important part of the picture, but some people include that in their management strategy. Controlling coccidiosis in lambs using either Bovatec or Decox in our creep feeds is critical, but we need to make sure that we get the right amount into them. My preference is to use Decox at a pretty high rate in my creep feeds, so that I get therapeutic levels. I get enough drug into each lamb every day at pretty low rates of consumption of that creep feed. Bovatec is harder to do that with because it is a not incredibly safe drug. So if we put it in at really high levels for young lambs, we'll actually get really close to toxic levels in lambs around feed. So my preference is to use Decox, but there are lots of people that use Bovatec very successfully. We also have Baycox available to us as a coccidia control. When we give that Baycox is the big question mark. So the label for Baycox and the instructions and education from the people who make it and sell it are to give that Baycox as close to when we normally see a coccidiosis outbreak as we can without going over. So just before. So if we normally see coccidia at 3 weeks old, then giving the Baycox to lambs between 2 and 3 weeks old is probably ideal. Giving Baycox to lambs before they leave the lambing jug, so at less than 3 days old, sets us up for the opportunity that those lambs see very little exposure to coccidia, to develop immunity to coccidia, maybe till well on into their life. So lambs that normally get a little bit of exposure to coccidia without getting a lot of it develop immunity to cocci, and then for life they're kind of okay. But if we give Baycox at 2 or 3 days old, and then we get really good consumption of a creep feed containing Decox for sure and Bovatec maybe, and then we put our replacement ewe lambs on a feed that also contains probably Bovatec at that point, we may not actually let those lambs have any major exposure to coccidia until maybe just about lambing time, or maybe till after breeding, when they switch off of ewe lamb replacer ration. So we're going to be a little bit careful there. And if we use Baycox as our only solution and don't have a good coccidiostat in our creep feed, or we don't feed creep feed for some reason, the Baycox is going to work for a little over a month. So suddenly at 5-6 weeks old, we can start to see coccidia outbreaks, and then that can be a little bigger disaster to work with, bigger lambs, and challenges of thinking about withdrawal times on what we treat them with. When we get outbreaks, we may use a drug called Amprol for 5 days. There are some vets that like to use Amprol at a higher dose for just one treatment. Physiologically, it doesn't make sense to me, but if that's what your vet does and it works, carry on. But if it doesn't work maybe that well, talk about using a 5-day treatment. There's a drug called sulfamethazine that we sometimes use as well, and we may use Baycox in the middle of an outbreak sometimes, even though the label says not for treatment. It does actually work very well in the midst of a cocci outbreak, so we do that sometimes, particularly on lambs that are still nursing, and we've got a bunch of them. Baycox can be really good. Ampril in the water really only works if we've got lambs that are weaned and drinking a consistent amount of water. Keep lambs out of feeders, break up lambing groups so that we don't have a bunch of lambs that are like 5-6 weeks old in a pen that are likely shedding a bunch of cocci, even though they don't have coccidiosis, don't have any signs of disease, and exposing lambs that are just a few days old into that pen. Do not reuse post-lambing areas without a thorough cleanup. So one of the toughest places I ever had to deal with coccidiosis was a barn that was very difficult to clean out in the winter time, especially winters like we're having this year. And he tried to lamb 3 groups of lambs in that barn that stayed till they were probably 2 to 6 weeks old and then moved. And by the time he got to that 3rd group, we needed Baycox to keep things under control, or we were in pretty big trouble. Don't forget to consider cocci as a factor in other disease outbreaks. I'm running out of time, so we'll do pneumonia pretty quick here, guys. Pneumonia is primarily bacterial, caused mostly by a bacteria called Mannheimia hemolytica. Lambs will have a fever, will be lethargic, will likely have an increased respiratory rate. They may have a cough and may have nasal discharge, but often they don't. They're not very consistent and not very obvious. 2 problems with pneumonia. We will have animals that die acutely, die in the first 3 days that we notice them sick, and we will have some animals that we save but just barely, and they become chronics that do poorly and grow poorly and end up being crappy market lambs, but are not dead. Vaccine is a question mark. There are no vaccines available that have strains that protect against the strains of the bacteria that we see in sheep. So the cattle vaccines that are out there, there's some intranasal cattle vaccines that some people have tried using, and they are the wrong strains to work very well. There was some research done in Western Canada a few years ago on a couple of vaccines that are available in other parts of the world, and they showed very little effect on pneumonia. Studies weren't perfect, but the bottom line of that was probably not really the answer. And some of that looked at giving the Yo's vaccine before lambing to try to boost the colostral protection, and some vaccinating the lambs themselves. Think about the environment if you've got more pneumonia than you like. So temperature, drafts, bedding, ventilation, stocking density, and immune function. So other diseases, nutrition, mineral status being part of the troubles. We're going to treat those pneumonia cases with antibiotics. We might, in some cases, give a painkiller, an NSAID, or a steroid, things like Predef or dexamethasone to those lambs, but probably not to all of them. Early treatment is key, and remember that when we give those drugs, we are creating withdrawals. And so if we have lambs that get pneumonia typically around weaning time and we sell relatively light lambs, we need to be very careful about what antibiotics we're using, and that we remember to follow the withdrawal time recommendation that your vet has given you, because most of those drugs do not have sheep withdrawals on the label. So you need to talk to your vet about what the withdrawal time should be. Enterotoxemia is like a whole talk in itself. Bottom line here is prevention is key. So vaccinating the Yo's 4 to 6 weeks before the start of the lambing season is the very best way to confer protection to lambs for the first about 12 weeks of age. We probably don't need to do slaughter lambs in most cases, but there are places that see value in doing lambs pre-weaning to protect them there. We don't want to do Yo's at 0 to 2 to 3 weeks before lambing, because they haven't had enough time to use the vaccine to make antibodies and put it into the colostrum. That's a thing that takes time, and it takes about 4 weeks to work. So so some people like to vaccinate it 2 weeks before lambing starts, and that's almost for sure wrong. We do have a Clostridium antitoxin that is available as an injection that we sometimes use in high-risk lambs, like maybe all of our milk replacer fed lambs, to help protect them if that is what we think is one of the reasons for trouble of death in our milk replacer pens. I'm only a little bit over time, not too bad, so we'll flow with some questions. Thank you, everybody, for sticking with me. Hopefully everybody's awake.